everyone. I am Dr. Rahul Agarwal, vascular surgeon. So today we have a middle-aged patient who has come with left lower limb varicose veins. He has got an ulcer associated with varicose veins, and he has been suffering from that ulcer since about a month. Now he is diagnosed with varicose veins with the help of clinical examination and ultrasound, and he is posted for endovenous laser ablation today under local anesthesia. So you all understand that varicose veins is dilatation and tortuosity of the varicose of the main veins. Then they are called as varicose vein. But it's not just the tortuosity, but if there is a reflux or a reverse flow in the vein, even then it's known as varicose veins, and that is what actually leads to the symptoms. So come, let's see the procedure of endovenous laser ablation. Come. And ready for the procedure. We are going for the endovenous laser ablation of varicose veins. Okay, so that is the main GSV with lot of tributaries, and so we actually take a puncture or the axis in the GSV below the knee, almost about 10 to 15 centimeters below the knee joint, and here will be the point where we will be taking the axis. So this procedure is completely under local anesthesia. The patient is fully awake, and when we are giving a local anesthesia at the point of axis, we inform the patient that we are giving a small injection. So this is a very fine injection or the needle that we have used to give anesthesia. That is a 26 gauge short needle. Okay, yeah. So that is an 18 gauge puncture needle or the access needle, which we are going to use to take an access into the great saphenous vein. This is an 035 guide wire. Now this has got a floppy J-shaped tip. We will be using this to introduce through the needle, and over this we will be introducing a 6 French sheath, which we will actually use to introduce our laser fiber. Going freely. Okay. We just top up the axis with some more local anesthesia before making it or dilating it. The laser fiber. So this is from the Biolytic company.
So this is the marker light, which will guide us to know the position of the tip of the laser fiber, which you can see here. Okay, you can trace it.
Now, to double confirm the tip of the fiber is in the actual vein that we are treating, and to see the position of the fiber tip at the junction, we have to use ultrasound. Now without ultrasound, going blindly for this positioning of the fiber and the tip is not recommended. We are at the junction. We are pulling 2 centimeters approximately. Yes. थोड़ा पीछे आके देख, ठीक है. So we have secured the position of our fiber tip, and now we see that we don't move the leg or change the position of the table. This is the setup for giving the tumescence anesthesia. This is a 20 cc syringe with an same 18 gauge puncture needle, and that is connected to a NS bottle in which we give soda bicarb and some local anesthetic with adrenaline. So again, after giving local anesthesia under ultrasound guidance with the help of a puncture needle, so this is how we reload it, and then after positioning the needle in the saphenous fascia, confirm it in the ultrasound, and then inject. We keep reloading again. That's all. When it's ready, inject. So within the time I reload my syringe, the expert doctor puts his needle and positions it along the fiber in the fascia, and I am ready for the next injection. Under ultrasound, where our fluid has traveled along the fiber, and as soon as we see that it is no more extending or progressing in the fascia, then we take a new puncture and get a new axis along the same fiber. Around the junction, that is saphenofemoral junction, is very important when we are doing the laser ablation. You have to be sure that the tumescence is beyond the fiber tip. It is anterior, posterior to the fiber tip as well, so that there is no DVT or extension of the heat energy into the deeper veins around the junction. So reconfirm the position of the fiber tip under ultrasound before you start the laser ablation, and we have the control of the laser ablation in the foot. So this is the foot pedal, that is the switch which will switch on and off the laser. Okay, so this will be under control of the person who is actually pulling the fiber out during the ablation. This is the laser which is actively firing. So when the foot pedal is pressed, then this system state is mentioned as firing, and it's also mentioned as laser firing. So these are the settings that we use. This is a 1470 nanometers diode laser machine, and that's a laser fiber that we are using. So laser power is set at 10 watts at 1470 nanometers wavelength, and 80 joules is the energy that is given per every centimeter. So the energy can vary, but we give it at 80. We have the best results with that. And you can hear there is a beep from the machine after every 80 joules is given. Like that was a beep. Let's hear the next beep. Right. So that beep tells us that 80 joules has been given. So between the each beep there is 80 joules, and we start pulling the fiber. So these are per centimeter markers. Okay, these are per centimeter. So for every beep we pull out 1 centimeter. It can be continuous or interrupted. That's the surgeon's choice. And also you can see here that is the glow, that is the tip of the fiber is here. So we put a mild compression there. Tighten here. So now we are nearly at the end of the procedure. The laser fiber, as you can see, here is the glow, and we are very close to our access point. Now before we come out or completely come out of the procedure of the skin, we actually switch off the laser and then bring the laser fiber out, so that one, we don't burn the skin, and as well the laser energy should not damage our eyes or ourselves. Right. So now we remove it. Yes. So this is the tip of the fiber. Just we can also confirm that there is no breakage or any for particle left inside. So at the end of the procedure, we confirm that the ablation has not gone into the deeper veins. So the common femoral vein is compressible and the artery is pulsatile there. And the rest of the GSV that we have ablated, it will not be clearly visible as of now, because there is a lot of tumescence anesthesia around the vein. So now you can see that the GSV, it is completely occluded and the lumen is not visible. You can see the soft tissue around it, it's all edematous, that is our tumescence, which will just fade away in a day. And now you can focus here. Now this was our access site. Now it's like a pinhole, so there is no scar post surgery, and all small needle pricks that were given, there will be no scar. So this is the completely scarless procedure for a varicose veins, that is endovenous laser ablation. Okay. So after completion of the procedure, we give a compression bandage to the patient and give him rest for about 20 minutes to 30 minutes, and he can walk after 30 minutes and go home. So this is a daycare or an outpatient basis procedure, completely scarless and under local anesthesia. No fasting or anything is required for this patient after the procedure. So the patient is still in the operation theater and is fully awake. అండ్ సో ఇప్పుడు మీరే చెప్పండి, మీకు అంటే సర్జరీ లోకల్ అనెస్థీషియాలో అయింది, మీకు ఏమైనా ఇబ్బంది ఉందా, ఏమైనా పెయిన్ అయిందా, ఏమైనా కంఫర్టబుల్గా ఉన్నారా, ఈజీగా అయిపోయిందా, లేదా మీ ఎక్స్పీరియన్స్ ఎలా ఉంది చెప్పండి.
నాకు చాలా మంచి నాకు అసలు ఏం అసలు ఆప్షన్ తెలియదు నాకు అసలు చాలా
కంఫర్టబుల్గా అయిపోయింది.
అసలు ఆప్షన్ నాకు అసలు ఉంటుంది ఆప్షన్ ఫీలింగ్
నార్మల్ ఉంది. సో అది సో ఇప్పుడే జస్ట్ సర్జరీ అయింది అండ్ హీఈస్ ఫుల్లీ అవేక్, హీ కెన్ వాక్ ఆన్ హిస్ ఓన్ అండ్ గో బ్యాక్ హోమ్. ఓకే, సో నడుచుకొని ఇంటికి వెళ్ళిపోవచ్చు. ఇప్పుడు ఏం కావాలి ఇప్పుడు తినొచ్చు, తాగొచ్చు, ఏం రెస్ట్రిక్షన్స్ ఉండదు.